It started with a routine shift, as usual, but this one was different. It wasn't chaotic. It wasn't loud. It was quiet, heavy, like the hospital itself was holding its breath. The call came through the patient call system from room 402. My heart skipped. I was the assigned nurse that night. My first night back after losing a patient 2 months earlier. I didn't know it yet, but the man in room 402 would become the moment I would never forget. He was 67, male patient. His name was Mr. John, diagnosed with liver cancer, stage 4, no transplant, no options, just time and pain. He had made the decision. DNR or no chest compressions and ventilation. But something about that night felt different. He had asked for the window to be opened, even though it was winter. He had asked if I could stay a few minutes longer, just to talk. And then he asked a question I wasn't ready for at all. Have you ever watched someone die? I froze before I could answer. He said, it's not scary. It's just quiet. When the monitors started to slow, I knew it was time. I called his daughter. She was on her way, stuck in traffic. I promised her I'd stay. The lights in the room were normal. His breaths were shallow, almost non-existent. The space between them stretched longer until I found myself counting. Waiting. I'm scared, I whispered. Not to him, to myself, because this wasn't CPR. This wasn't adrenaline or defibrillators. This was waiting with someone until their last moment. And then it happened. A long breath. Then silence. The monitor beeped once, then flatlined. No alarms, no team rushing in, no noise, just me and him. And the sound of the wind through the window. I didn't move. I didn't cry. I didn't even blink. I just sat there because, for the first time in my life, I wasn't just watching a person die. I was present in their final breath, and I realized something I had never understood before. Death is not always violent. Sometimes it's still a whisper, a slow release, a kind of return. His daughter arrived 15 minutes later. When I told her, she broke down, but then she hugged me tight. He wasn't alone, she said. That's all that matters. That night, I walked out of the hospital changed. I had watched people die before. Sudden, dramatic deaths in the emergency department. But this was different. This was unforgettable. And it broke something in me, but also rebuilt something else. Learning lessons for healthcare workers. Sometimes, presence is the most powerful form of care. Being with a patient in their final moment is not a failure, it's a privilege. We are not just healers of the body. We are guardians of dignity even in death. Learning lessons from medical and nursing students. Learn how to save lives. Yes, but also learn how to witness life ending with compassion and calm. Death is not the enemy. It's part of the cycle. How you show up in that moment defines your humanity. Learning lessons for the public. Dying alone is one of the greatest fears many patients have. A hand held, a calm voice, a simple presence. These matter more than you know. Talk to your loved ones. Know their wishes. Be there when you can. Closing reflection. I used to fear death, but after that night in room 402, I no longer do, because I've seen that the end isn't always darkness. Sometimes it's soft, and the person who bears witness, who stays, can make it beautiful. And this was the story that changed me forever. This is Silent Scrubs. Real stories, no faces, just truth. If you like the story, subscribe and stay with us for the stories no one hears. But everyone should.